Now, you might want to ask that for a patient that has hypertension, me trying to know where this patient works, is it important? Okay. So, if it is important, what are the questions I should ask as regards where this patient works? Okay. That's for a hypertensive patient. Okay. So, as you are measuring the blood pressure, you're interacting with the patient and you're asking them a lot of questions that will help you pinpoint what primarily caused this issue. Okay. So, occupational history is very important because some jobs and what these patients are exposed to contributes to high blood pressure. Okay. And sometimes maybe you are managing, but there's no improvement because of their workplace. So, first, you ask where they work and the stress level, what is their occupation, and do they work in high stress environment? Like, are they working under deadlines? Are there a lot of responsibilities? Are they understaffed? Are they working in a conflict zone? So do they work for a very long time? Or do they always work in the night? Then also how much control do they have over their workload? Physical activity at work. You ask if their work is this type of work that when they go, they just sit down in one place. Or do they get regular breaks to move around? Or do they engage in strenuous work? Exposure to substance. You ask if they are exposed to chemicals, dust or fumes or heavy metals. You also ask if they work in a noise polluted environment or vibration environment. You also ask if there's any radiation or hazardous material that they are being exposed to at the place of work. You know. So workplace habits, you ask if they consume a lot of caffeine or energy drinks. You ask if they smoke or drink alcohol. Okay, probably not them, but other people in their workplace too, because there could be secondary smoking. You ask if they skip meals, you know, at work or they eat regularly. The shifts work and sleep is you ask if they work night shift or rotating shift, how many hours of sleep do they get, and do they feel good after they sleep or they still feel tired. Then you ask about their job satisfaction, if they are financially stressed. Do you understand? If the person who gave them the job is supportive, is host or is hostile, then minus their current place of work, you also ask about the previous places they have worked, okay? Because this could be accumulated effect over time.